Hello and welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Cardiovascular-Kidney-Metabolic Syndrome, a presidential advisory from the American Heart Association. A deeper understanding of how obesity, diabetes, chronic kidney disease and cardiovascular diseases are interconnected has paved the way for a new concept of cardiovascular-kidney-metabolic syndrome, according to a presidential advisory from the American Heart Association. This syndrome, born from the convergence of metabolic risk factors and chronic kidney disease, is closely tied to higher risks of adverse cardiovascular and kidney outcomes. While considerable progress has been made in comprehending and managing this syndrome, significant knowledge gaps remain. These gaps include the mechanisms behind disease development, the diverse clinical characteristics of affected individuals, the intricate interplay between social factors and biological risks, and accurate assessments of disease occurrence amid various competing risks. Alcohol consumption and smoking increase risk of glaucoma. A comprehensive retrospective cohort study conducted at 3 tertiary glaucoma centers in the USA has shown that alcohol consumption, particularly in men and individuals of African descent, is associated with an increased risk of developing glaucoma, while the risk of glaucoma development in smokers is influenced by age, with older individuals having a higher risk. This research, based on data from the Diagnostic Innovations in Glaucoma study and the African Descent and Glaucoma Evaluation study, sheds new light on the risk factors associated with this eye disease. The study tracked 825 eyes belonging to 610 patients, all of whom were glaucoma suspects with normal visual fields or VF at the outset. Aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code or access the link in the description box below. Bladder cancer, how new treatment approach may help patients avoid life-altering surgery. A combination treatment approach with gemcitabine, cisplatin and nivolumab in muscle-invasive blood cancer patients resulted in a clinical complete response rate of 43%, enabling bladder preservation without immediate cystectomy. The study published in Nature Medicine revealed a clinical complete response rate of 43% with 97% positive predictive value of clinical complete response, signaling a potential paradigm shift in the treatment of muscle-invasive bladder cancer. While cystectomy is a major surgery, until now it has been the best chance for patients with muscle-invasive blood cancer to be cured of the cancer. Muscle-invasive blood cancer, or MIBC, is often located in the deep part of the bladder. It can be difficult to completely remove the cancer without removing the entire bladder. Type 2 diabetes and how over 60% patients have vitamin D deficiency. A recent study found that 64.2% of patients with type 2 diabetes mellitus suffer from vitamin D deficiency. Factors such as poor glycemic control, obesity and other complications were identified as predictors of vitamin D deficiency in these patients. Type 2 diabetes mellitus is a multifactorial disease triggered by the interplay of many malfunctioning mechanisms that occur simultaneously. In addition to genetics, which predisposes individuals to develop type 2 diabetes mellitus, many environmental factors such as physical inactivity, abnormal dietary practices and obesity contribute greatly to its development. Moreover, recent evidence suggests that existence of vitamin D deficiency contribution to the pathogenesis of type 2 diabetes mellitus. The analysis included 54 studies with 38,016 participants. The study, conducted following preferred reporting items for systematic reviews and meta-analysis guidelines, identified several factors including poor blood sugar control and obesity as predictors of vitamin D deficiency in these patients. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.